we're going to go through a step-by-step on how to set up an EVD. As a nurse, the expectation would be that you do know how to set this up. For our neuroscience APPs, we'll be able to help you troubleshoot should there be any issues. So we'll start with the supplies that you're going to need to collect before getting started. So the first thing you're going to need is an IV pole. The next thing you're going to need is this setup here. This can be found in your supply room. This is what the EVD connects to, and it's also what will help you with your loop level, drainage of the cerebral spinal fluid or CSF, so on and so forth. So if you come here and see, I'm going to show you how to first connect it to the IV pole, and then we'll just go step by step with it. So there's a little knob here. What you're going to do is just squeeze it, and you can see where this will adjust on both ends for you. So I'm going to squeeze it, connect it to the IV pole here, and you can see that it's secure there. As an extra precaution, what you're going to want to do is to take this string here, and you're going to connect it up here. There's no right or wrong way to do it, but the point of it is if this ends up coming off of the IV pole, you have an added sense of security, if you will, so this is not pulling on a catheter that's in the patient's brain. The other thing that you're going to want to do is these little tabs here. You're going to want to put this through here. So we have three safety, this one's broken here, but you would put it here. So we have three safety things. One's attaching it to the IV pole. The second one is the string attached here to the hook. And the third is your plastic, I don't know what to call this, but another plastic string that's attached here for you. Okay, so we now have this properly connected to the IV pole, ready to get started. This is what you will use for your level. It's a leveler, so if you have laser levelers, there's not a right or a wrong device to use. The key is to make sure that it is level and it is level to the tragus. And you can adjust this up and down on the IV pole, as you can see here, based on the patient's head of bed position. So I'm just going to set this here. I'm going to go ahead and just put this up here, just so that way it's out of the way. So we're ready with that. The other thing that you're going to need is a transducer, and you're going to use the same one that you would use for an art line. There's a little piece that's connected here. This one doesn't have it. We're using it for training purposes. You would disconnect it just thoroughly. You do not need that. This is the only thing that you will need. Nothing more, nothing less. And then just making sure that you're able to zoom in here. There is a lure lock. You're going to take this piece and connect it to the lure lock here. And I give it just a nice little jiggle. Make sure it's nice and secure and it's not loose, okay? So this is where it's going to go on, okay? The device, machine, monitor. The monitor will be up here. You connect your cable cords, and there will be a separate line that pulls up. I think it's typically purple, but you can program it however you want. But it connects to the monitor, and that's where you're going to end up getting your ICP level and then also your waveform for the notches, okay? So we have this set up. This is what would connect to the patient. You can see that this is kept in a bag. It is sterile. Do not open this until it is ready to be connected to the patient. If you open this and the catheter, or not the catheter, but the distal end drops on the ground, this whole system's contaminated. You need to throw it away and start over. One, think of infection, quality control. The other thing is if this for some reason were to get contaminated, you could end up giving that patient ventriculitis, which is not ideal for them, to say the least. So you definitely want to make sure that this is secure. I feel comfortable dropping it down here. I see that it's in